having one or two pharmacies located in our community here is just not going to do the job.
Reports continue to show how racialized Canadians are still some of the most at-risk people when it comes to contracting COVID-19. And as a vaccine plan rolls out across the country, there are growing questions about access and who is at the front of the line. It's an issue in this community, Northeast Calgary, an area which consistently sits near or at the top of the list for COVID-19 cases. A highly racialized area with a high proportion of frontline and essential workers.
My concern is about the logistics and distribution of how folks in our communities are going to be vaccinated.
Like much of the country, Alberta has chosen to emphasize vaccinating the elderly.
They would have had the ability in phase 2 under federal guidelines to also look at risk factors, people who are higher at risk, whether they are people with pre-existing conditions, which they did include, or if they're people who have to deal with the public a lot and can't stay safe, and they chose not to do that.
A Government of Manitoba report shows people of color have seen disproportionate infection rates. And new guidance from Canada's National Advisory Committee on Immunization says adults from racialized communities where that's the case should be prioritized for shots in phase 2 of the vaccination campaign. But even if people in these communities are given higher priority, easy access remains a concern.
Right now, having one pharmacy on the southern end of my ward when we have close to 100,000 residents is not enough.
We're continuing to work with the Alberta Medical Association and those family physicians to onboard the physicians who are interested in being able to have the capacity for them to be able to help us with the administration of vaccines in the community.
An issue Chahal believes will only be fixed with the clear communication of a distribution plan. In Calgary, Jonathan Muma, City News.